Hey guys, what's up? It's Mike. Today is July 16th, 2014. I am a year and about 8 months on D. This is an update video, clearly, obviously. I'm really happy because yesterday I scheduled surgery with Dr. Satterwhite. He's in Green Bay, California with Dr. Crane. He's gonna start doing surgeries in August. Um, My surgery is scheduled for November 13th, and I think that gives me a little bit of time to get comfortable and possibly maybe some results might turn up from him. And if I hate them, I can cancel or I can change my date back and maybe have it with Crane. Um, I spoke with Dr. Crane yesterday, obviously, and he made me feel comfortable. Um, so hopefully this will be the same thing with Dr. Satterwhite. Dr. Crane says that he's known him for a really long time, and he said that the new surgeon will be using the same method that Brownstein taught him. So that was also very comforting to me. But another thing that is even more comforting to me is that he's done facial reconstruction surgery. And you can't just fuck up a facial reconstruction surgery. Obviously, it's not going to come out looking great. It's not going to come out looking perfect because, I mean, if someone's face was fucked up from something crazy that happened, it's not going to ever look the same. But that is something that's comforting to me because I know that he will be, geared towards the aesthetic parts because that's just the type of surgeon that he is. That's what he's done. And so that is something that is really, really, you know, making me feel good about it. And like a couple of people have already said to me, Dr. Crane wouldn't hire some wacko surgery who couldn't perform. And even Dr. Crane said the exact same thing that he wouldn't just, get some random surgeon. And he said that he's seen results from the surgeon. I don't know if it's top surgery or what kind of surgery, but when I spoke with the office, they told me that they've been trying to get permission from his past patients because since they're not from, the patients aren't from their facilities, they don't have permission to show their results. So they're trying to get permission from the past patients. Um, I at this point, I'm really just kind of trying to get the surgery done. And if it comes out terribly, I am gonna be upset, obviously, but I won't, it's clearly my decision to go with a surgeon who I have no ideas about. I don't know how long, I don't even know if he's done child surgery before, and if he has, I don't know for how long. And it's my decision to go into it when he's only gonna be with Dr. Crane for about what 2 or 3 months. So, I can't really be mad at the surgeon. But if it does come out terribly, I'm obviously gonna get a revision. But I also am gonna offer constructive criticism to my surgeon because I think that it is important that people tell their surgeons like, hey, this is what I do like, and this is what I don't like, and this is why I don't like it, blah blah blah. And especially since he's gonna be new with Dr. Crane, obviously. Um, and I will, no matter how terrible it is, I'm gonna show it to people. I'll probably put it on Transbucket. If it's really bad, I'll probably put it on Transbucket without my face in the photo. But I don't think it's gonna be that bad. If all else fails, at least I know the nipples will be on right because he's done facial reconstructive surgery, so he probably has an idea of how make nipples look right on a chest and where to put them. Um, So that's a relief. But I am nervous about it. But everyone kept telling me to go with my gut, and that's what I'm doing. Um, and actually, recently, like a few days ago, I saw this post-op video of Dr. Crane taking off someone's bandages, and that just cemented everything for me because I was supposed to have a consultation with Dr. Garamoni today, but I canceled that obviously because I scheduled with Dr. Satterwhite, and it was just what I saw in that video was amazing. And you know how Dr. Garamoni has this whole script and he just basically he powers through it with every single person. Um, but that wasn't the case for Dr. Crane. He was actually having a conversation with his patient, and it wasn't stale and it wasn't like business. It was very, very personal, and it was like personable, and it was really it comforted me. And I get the feeling that the surgeon he's brought on will probably have some sort of similar way of communication. If he's hired him, he's known the surgeon for a while, and I'm hoping that I'm gonna see if I can get some sort of consultation with him. Maybe sometime soon. Um, just so that I can meet him. I mean, or just speak to him, just to know like doing my surgery. But obviously, I'm gonna see him on my pre-op, which is November 12th. Which what's funny is I'm skipping class for this. I'm already skipping I plan to skip class for this. Actually, on those days, I have a political science and math class. But two of my classes are online classes for the fall, which I did purposefully in case I didn't have a choice but to have surgery during school. And another good thing about not going to Florida is the fact that I'll be able to kind of do stuff here that pertains to school. And Dr. Crane was telling me that he's had some patients who've had surgery, and the same day they're just like out doing stuff. And another thing about him is that he doesn't use drains. So I'm pretty sure Dr. Satterwhite isn't going to use drains because he's using the same method as Dr. Crane. Dr. Crane said that he hasn't used drains in over a year. He hasn't had any problems. Actually, my friend who went to Dr. Crane said that he had drained. Like it was the last. It was a while ago. He had a surgery with Dr. Crane, and he said that he didn't bleed at all. Like his drains were like he didn't need his drains. So Dr. Crane stopped using drains, and that's something that is really just pulling me like, hey, no drains. And he says that it really does reduce the pain, the amount of pain. And I also think that it's going to allow me to be more mobile because I do have school and I can't just miss like 3 weeks of school just because of surgery. I'm only probably going to miss the the days of my pre-op, my post-op, and my actual surgery. I'm only going to miss 3 days of school, and during the rest, I'll probably just have someone drive me around, and I'll try and be normal and let my teachers know that I've just been cut open. Um, but other than that, I'm actually really excited. I paid my scheduling fee. On August 1st, my insurance plan with Anthem Blue Cross will kick in, and then I will submit letters and things like that to Crane's office, who will then submit them to the insurance company. They have like a little partnership with the Anthem Blue Cross. I have Anthem Blue Cross and Medi-Cal, so and they accept that, so they have a little partnership with them. They're in the network with them, and so they've done it several times. So that's refreshing for me to know. So they know how to do that. They told me I only needed one letter, so hopefully that is the case. Um, and I'm happy that I've scheduled it back until November because I have a little cushion in case things happen. And if it all gets pushed through, then maybe they'll let me push my date up. Um, just so that I can get it as soon as possible. But that's it for this video. I will obviously be updating about a few other things. I'm gonna make a video once we get moved into our new place and whatnot. Um, I won't have a bed, which sucks. Um, I'm not gonna buy a bed until I know that my surgery is gonna be covered. Because if it's not, then I'm gonna have to do some other little things. But yeah, that's it. I will talk to y'all later. So.